What is prostate cancer?
So prostate cancer is detected generally in the 6th decade of life to 7th decade of life, generally in your late 50s, 60s and 70s. Poor lifestyle as in smoking, excessive drinking, sedentary lifestyle and being overweight or obese. These in combination have led to an increase in the prostate cancer incidence. In advanced stages, prostate cancer that has spread to the bones, for example, can cause bony pains, joint pains, low back pain, or even fractures.
People are concerned about urinary control and also the sexual health.
And it may take around a year to even 2 years sometimes to achieve a return of sexual function. High PSA always means prostate cancer. So I'd like to allay the fears of the viewers that is not true at all.
Hello and welcome to India TV. I am Shivangi and you are watching HealthDNA. In today's episode, we are going to discuss everything about prostate cancer because it is one of the most common cancers among men, yet it is also one of the least talked about. Many men don't notice the symptoms, delay screening or believe myths that stop them from seeking help. So today we are breaking it all down, what prostate cancer really is, who is at risk and what treatment and life after diagnosis actually looks like. For this we have with us Dr. Ashwin Mallya, Senior Consultant Urologist, Sir Ganga Ram Hospital. So welcome to India TV.
Thank you very much.
Now to begin with, I would like you to inform our viewers first of all about what is prostate cancer and at what age is it most commonly diagnosed in men.
So cancer by definition means unregulated growth of cells. So that holds true for prostate cancer as well, where the normal multiplication of cells gets dysregulated and there is excessive growth of cells. So, prostate cancer is detected generally in the 6th decade of life to 7th decade of life, generally in your late 50s, 60s and 70s. So that's the age group we commonly see this cancer in.
And is it always life-threatening or not?
No. If detected early, so it is completely curable, and prostate cancer generally in most cases is a slowly growing cancer.
Okay.
So we have adequate time to treat it, cure it, and but in some cases when there is a high grade of prostate cancer, it is liable to spread fast and even cause mortality.
So what are the risk factors associated here, and also what is the role of genetics in that?
So the risk factors, there is no direct cause and effect a relationship in prostate cancer for tobacco chewing, for example, is a known risk factor for oral cancer. We don't have a similar analogy for prostate cancer. Prostate cancer is generally multifactorial. So age is the biggest risk factor. So as you grow older, the chances of getting prostate cancer increases. Any family history which will give you a genetic basis for the disease. So if at least there are multiple relatives in the family who have got either prostate cancer, ovarian cancer or breast cancer, they belong to the BRCA2 gene mutation. So those people are more predisposed.
Okay, so even if someone in a family had breast cancer or ovarian cancer, then also the chances are high of prostate cancer.
Yeah, if the genetic link is the BRCA2 mutation.
Okay.
In that case, yes. But apart from that, poor lifestyle as in smoking, excessive drinking, sedentary lifestyle and being overweight or obese. These in combination have led to an increase in the prostate cancer incidence. But apart from that, it's mainly age and genetic factors.
So, okay, so age and genetics play a main role, I would say primary role. And diet and lifestyle comes later on.
Yes, absolutely.
And as of now, we know that, people generally do not maintain a perfect diet or a perfect lifestyle.
Yes.
We have a sedentary lifestyle. We sit for like many hours, but we do not like to exercise or eat healthy. So I think that is also affecting men.
That plays a role. That definitely plays a role.
And so moving on to the symptoms, because symptoms are also very important. But many times, especially men, they do not, I guess, they do not talk to others or maybe hesitate. What are the symptoms that often they miss, but later on they might become, bigger?
So in the early stages, prostate cancer may have no symptoms whatsoever. So it is generally detected by a simple blood test called the PSA blood test, which is prostate specific antigen. It's a simple laboratory test which can be done in any registered laboratory, and presence of symptoms generally means that there is a slightly increasing burden of disease, either locally or it has even if it has spread. So many times urinary symptoms due to benign enlargement, that is age related benign enlargement of prostate, they can overlap with the prostate cancer symptoms. Sometimes even just we detect prostate cancer because a patient has come with urinary infection or urinary symptoms. But urinary symptoms alone does not mean that the patient has prostate cancer.
Okay.
We have to differentiate between the two, and that's where a urologist comes in. In advanced stages, prostate cancer that has spread to the bones, for example, can cause bony pains, joint pains, low back pain, or even fractures due to prostate cancer spread. So that is when we are detecting patients in advanced stage as well.
But many times we have seen that the symptoms do not show in the early stages. Why is it so?
That's because the growth of cells is happening in one area of the prostate and is not necessarily causing any symptoms. It's not causing any urinary obstruction. It is not causing any harm to the prostate or the surrounding structures. When it starts becoming larger, as in the prostate cancer lesion, when it starts gaining size, it compresses on the urethra, for example. That time it can cause urinary symptoms.
Okay.
Or even blood in semen. We have seen that as one of the reasons for blood in the semen as well. And if it has spread to various areas of the body, any symptoms related to that area. Okay. So when it is an isolated lesion in some corner of the prostate, it may be absolutely symptomatic. But one way of detecting it early is by doing the PSA blood test.
Yeah, I was about to come on that as well. What is PSA test and how reliable it is?
So PSA basically is an enzyme which is produced by the prostate. Normally the level of this is less than 4 nanograms per ml. Increase of PSA does not necessarily mean it's prostate cancer. That is why it is just a screening test. It is not a confirmatory test. So once we have an elevated PSA value which has been interpreted by a urologist, then it has to be, the further workup has to be done to ascertain whether there is prostate cancer or not. Okay, and it's a fairly reliable test, but it has many causes for false elevations. For example, a person with a urinary tract infection may have an elevated PSA.
Okay.
With urinary retention may have an elevated PSA. So that is why it is called prostate specific antigen. It is not prostate cancer specific antigen.
So it needs to be interpreted by a specialist, by a urologist, and there might be other reasons for high PSA level as well, but people do not need to be scared out of that.
Absolutely. I think knowledge is power. So get it evaluated by a urologist. I think he would be the best judge about what's happening.
And so what age and which particular individuals are recommended to have this screening?
So screening generally, I think in routine practice by the age of 60,
okay,
everybody should have at least one PSA test that has been done, following which you can do it at least once in 2 years, if not every year. If you have a family history, then I would recommend starting it at the age of 50 to 55 itself, because there may be a chance that you may get prostate cancer, especially if there are multiple relatives who have suffered from the genetic mutation. After the age of 50 in people with family history, after the age of 60 in people without a family history.
Okay, after 50 and then 60.
Yeah.
But sir, moving on to the treatment section, we had a discussion on what prostate cancer is, the risks involved, symptoms and all, but treatment is also an important factor. What are the treatment options available, and is it designed on the basis of a particular individual's health and report?
So all medical decisions should be catered to individuals rather than using a one size fits all approach. So the patient's general condition, whether he is fit for operation, whether he is willing for operation, so those kind of factors are considered, and whether the disease is confined to the prostate or has it spread to the lymph nodes or to other areas of the body. That again decides what kind of treatment.
So what all treatments are available for that?
So for disease that is confined to the prostate, generally the gold standard is robotic prostate cancer prostate removal, what we know as robotic prostatectomy. The other options that are available are radiation therapy to the prostate, and there's a emerging option called focal therapy, which targets only the lesion, which has the cancerous lesion, using HIFU or cryotherapy. So that is still emerging and it's used in selected cases.
So there is also immediate treatment or active surveillance. Does every patient need immediate treatment, or active surveillance can also help in many cases?
So active surveillance is used very selectively.
Okay.
So especially it's used in people who have very low grade disease, as in what we call as grade group 1 disease, and they have very few cores in the prostate biopsy that have come positive for cancer, and the PSA level should be less than 10. Okay. And the most important criteria is the patient should be willing for regular and rigorous follow up.
Okay.
And should be willing that he will move on to treatment when needed. Only such patients are fit for active surveillance. Rest everybody need treatment.
Okay.
Yeah.
And so as you were saying about robotic surgery, I am very curious about how this robotic surgery takes place. Could you please inform our viewers also about that?
So robotic surgery is a very useful way of treating prostate cancer in 2025. It has been in existence since the last 25 years across the world, and in India it has made great headway in the last 10 to 15 years. So now the availability of robots is quite good in India as well. It's available in multiple hospitals and even in the government sector, which is a very heartening thing. So robotic surgery does not mean that the robot is performing any surgery. It basically means that we are performing the surgery with the robotic precision and accuracy.
Okay.
For example, I am sitting at a console where I have 3D vision, and vision which is 10 times magnified. So I can identify each structure very well, and the instruments are passed through ports connected to robotic arms. So there is absolute tremor free movement and very accurate execution of the whatever I move at the console, the robotic arms execute within the body.
Yeah.
So I am able to perform the steps of surgery with very good vision, with very little blood loss, through small incisions, so that what does it help in how does it help the patient? I am able to perform surgery with minimal morbidity, with through small incisions, very accurately,
Great precision.
with minimal blood loss, so that the patient gets the benefit of early recovery and he is back to work very quickly, and I can perform the nerve sparing, for example, accurately with the robotic surgery, and it helps in the functional outcomes.
And how much time it takes for recovery after this surgery?
So the patient is up and about the same day of surgery.
Okay.
The same evening of surgery or the next morning, the patient is up and about. Patient is discharged within 48 hours, 24 to 48 hours of surgery, and he recovers within 8 to 10 days and is probably back to work within 2 weeks.
Oh, that's nice.
Absolutely.
But sir, with treatment comes risk, these risk of side effects. People are generally concerned, and I would say they are scared about the side effects of treatment, especially whenever they hear cancer, they think of a lot of things, and that's the biggest, I would say, fear in the minds of everyone, I believe. So speaking about prostate cancer and the treatment involved, people are concerned about urinary control and also the sexual health with this. So I wanted to ask you, or also inform our viewers about this, as to how after the surgery or during the treatment, how all of this takes place, and are these side effects, are these only permanent, or are they temporary?
Yeah, so it's a very valid question. So when we counsel patients about robotic surgery, we address that our outcomes, we have 3 priorities.
Yeah.
The first is the cancer control, oncological outcomes. So the first priority is to make the patient cancer free. So in the bargain, we end up achieving a little bit, getting some urinary incontinence following surgery, but with modern techniques, what we have developed over the years, we are able to give the patient either immediate control after the surgery, as soon as the urinary pipe, that is the catheter, is removed, or in many cases within 1 to 2 months. So for 1 to 2 months, many patients use diapers because they have some leakage of urine, which is more to begin with, and within 1 to 2 months with rehabilitation, they achieve full urinary control. As regards your second question, the sexual health, so erectile nerves, the nerves which are responsible for erection, travel very close to the prostate. So as they are going to the penis, when we are performing prostate removal, so we may injure the nerves that are going to the penis. So in essence, we try to save at least one side of the nerves so that sexual function can return. If it is very early disease, we may be able to achieve sparing of both nerves, both sides of nerves. So if we are able to achieve that, we have a faster recovery of sexual health. And if we are unable to achieve it, it takes more time, and it may take around a year to even 2 years sometimes to achieve return of sexual function.
So these side effects are not permanent, right?
So these side effects may not be permanent, again based on the stage of the disease and the finesse with which the operation is performed, the technique with which the operation is performed, we may be able to preserve both the urinary control and sexual health.
Okay, so it takes time, but the side effects are, temporary, might be temporary in many cases. They are not permanent, so you do not need to fear about that.
Absolutely.
But sir, moving on, you've been in this industry from a very long time. What are the biggest myths that you've heard about prostate cancer?
One great myth is what we already talked about, is PSA, high PSA always means prostate cancer. So I'd like to allay the fears of the viewers that that is not true at all. So a PSA test report has to be evaluated by a urologist who will be best able to guide you about how to proceed. Number 2 myth I have heard a lot is that prostate biopsy results in spread of disease. So that is absolutely not true. I don't think any urologist would be treating prostate cancer without a prostate biopsy. Prostate biopsy per se does not spread disease. So in most cases we have to do a prostate biopsy for deciding on the treatment. One other myth that I have heard is either on both sides, prostate cancer is absolutely harmless or prostate cancer is a death sentence. So both are not true, because the truth is somewhere in between, depending on the stage of disease and depending on the treatment available. You can be either cured or at least the disease can be controlled, if not cured.
Okay. And sir, moving on in future, what all treatment options do you think are going to come, which would, bring about a lot of change in this?
So, moving forward, I think robotic surgery is getting more and more advanced. We are getting newer technology within the robotic ecosystem, which is like integration of AI, 3D modeling and things like that, which are absolutely helping us achieve better outcomes. Year by year, we are achieving that. Number 2, advanced techniques of technology of delivering radiation therapy itself. Very precision radiotherapy systems are available in most advanced hospitals, which are able to give very accurate delivery of radiation to the prostate. Focal therapy, which is an emerging technology in selected cases, is emerging, and slowly in India also we are getting that system in many centers across India. In Europe and in the US it has been there for quite some time. So focal therapy is one that is emerging, and I think generally the integration of AI in imaging, in clinical decision making, all these things are going to help prostate cancer treatment. And coming to the prostate cancer that has spread, like metastatic stage 4 prostate cancer, we have many good medications that are coming, and each year more and more research is coming, so which helps us give an increased lifespan and quality of life for our patients, even in those who have been detected with stage 4 disease, that is metastatic disease. So I think even if a person has been detected with stage 4 disease, we can expect a decent lifespan and quality of life.
Talking about lifespan, sir, when people hear prostate cancer, they feel that, it is not curable. Is it true or false? Completely not curable, or it can be cured?
So again, like I said, the truth is somewhere in between, where there are patients who are very aggressive disease and very advanced disease. They cannot be cured, they can only be controlled. In people who are detected very early, they are cured for life. They may never need to
does the lifespan get affected in this during the treatment or anything?
If detected very early and operated in time, or treated in time, they may go on to live their normal lifespan. And they will go on to live their normal lifespan. And in those who have been detected at stage 4, the lifespan varies depending on how aggressive the disease is, how the patient is tolerating the treatment that we are giving. So it's an average of around 5 to 8 years even after stage 4 detection. But that number is increasing year by year because of the advancements in treatment for metastatic prostate cancer.
Okay. And sir, what would be your advice to men regarding prostate health that people should, take care of?
Yeah. So I would like through your program, I'd like viewers to understand that prostate cancer may not always present with symptoms. So a screening test is necessary, and that screening test is PSA. It's a simple blood test that can be done in a laboratory close to your home. So please get the PSA test done, but ensure that it is interpreted by a urologist, not by anybody else. Number two, the message I'd like to give is do not neglect urinary symptoms. Sometimes, because of urinary symptoms, we may detect prostate cancer. So let's not lose that opportunity. And you do not have to be embarrassed about urinary symptoms. You can visit a urologist, and good treatments are available just for the urinary symptoms itself. And in the process, we will be screening for prostate cancer, which is a good thing, especially if you are 55 to 60 years old. It will at least tell you the chance of, that you may have a risk or may not have a risk. So, and if you have a family history of prostate cancer, breast cancer, ovarian cancer in the family generally, it might be a good idea to talk to a, doctor about genetic tests. There are tests available just to know that whether you are at an increased risk for prostate cancer or not. So that if you are, then we start screening early.
Yeah.
That's all. So if you, because in the West, like the African American population, they start screening even at 45 years of age.
Okay, and what is the screening age in India that you generally see?
So we do not have a population screening policy.
Yeah.
Because it's going to be too expensive to screen every single person.
Yeah.
So in India, we generally follow a individualized approach, where people either through corporate health checks or through their own pocket are getting tested for prostate specific antigen PSA testing, or we do what is called opportunistic screening, where patients who present with urinary symptoms, we utilize it as an opportunity, because he has come for urinary symptoms, and we get the PSA testing done. So that so screening is available. Do not neglect your urinary symptoms. So that's the message.
That's a message, and that's a very big message.
Yeah.
And now, sir, moving on to our another segment in Health DNA, we try to break down the myth from the fact, because that is very important. People learn a lot of things on social media, they see on internet, and they feel that, this might be correct, this might be wrong. So it's very important to know it from the expert directly. So I'll just say a statement, and you'll have to inform if that is true or false. Okay. So the first statement is prostate cancer affects only very elderly men. Is it myth or truth?
It's a myth, because the youngest patient I have treated is around 45.
Okay.
So it can affect in selectively, younger age group also.
But majorly it is in the elderly section
but
only.
Majority would be detected between 55 and 70, but rarer cases even earlier.
Even earlier, okay. A high PSA test always means prostate cancer. That we have discussed, I guess.
So yeah, it does not mean, it's a myth. So it's a myth that high PSA is always prostate cancer.
It has to be interpreted by urologist,
yeah,
to find out the real cause behind it. The third statement is prostate cancer completely ends sexual life.
That's a myth again,
Okay.
because with increasing, with advancing technology, robotic surgery, and good medications available, we can give normal sexual function to even after prostate cancer treatment.
Okay. And prostate cancer cannot be controlled.
It's a myth. Prostate cancer can be cured in early stages and can be controlled even in advanced stages. So, I think that statement is a myth.
That is a myth. And prostate cancer can only be treated through surgery.
That's a myth again. There are other options available like radiation therapy and focal therapy, and active surveillance for those who are very early disease. So there are options available.
So these are all the, in fact, I believe all these statements, in fact, all were almost myths. But that we have busted, and thank you, sir, for all that. But what we have realized is that prostate cancer doesn't have to be a silent disease. With the right information, early detection, as you said, early screening and timely medical care, it can be detected early and managed effectively. So thank you, sir, for explaining the facts, and also for viewers, if you found this conversation useful, don't forget to like, share and subscribe, and most importantly, talk to your doctor, pay attention to your health, and encourage the men around you to do the same. So stay tuned with India TV for more such expert conversations. Thank you.